Have you ever heard someone say a patient is in AFib, but wondered what that actually means? Don't worry, because nursing doesn't have to be complicated. Let's make it make sense. So, what exactly is atrial fibrillation? Atrial fibrillation, or AFib, is the most common sustained cardiac arrhythmia. Instead of the atria squeezing in one coordinated contraction, they begin firing hundreds of electrical impulses at the same time. This causes the atria to quiver rather than effectively pump blood into the ventricles. Let's make this make sense. Normally, the electrical signal starts in the SA node, travels through the atria, pauses briefly at the AV node, and then moves into the ventricles. In atrial fibrillation, multiple abnormal electrical signals fire throughout the atria. The AV node blocks many of these impulses, but enough still pass through to create an irregular heartbeat. That's why AFib is known for having an irregular rhythm. So, what might your patient look like? Some patients don't feel anything at all. Others may report palpitations, fatigue, shortness of breath, chest discomfort, dizziness, or decreased exercise tolerance. If the ventricular rate becomes very fast, cardiac output can decrease because the heart doesn't have enough time to fill between beats. Here's your signature key. Don't memorize random facts. Understand what's happening. The atria are quivering instead of squeezing. Blood can pool inside the atria. When blood sits still, clots can form, and if one of those clots travels to the brain, it can cause an ischemic stroke. That's why one of the biggest concerns with atrial fibrillation isn't just the rhythm, it's preventing stroke. So what's your nursing priority? First, assess your patient. Don't just stare at the monitor. Check their blood pressure. Assess their symptoms. Determine if they're stable or unstable. Monitor their heart rate and rhythm. Evaluate oxygenation and signs of decreased cardiac output. And always remember, treat the patient, not just the rhythm. These findings should immediately get your attention. Chest pain, hypotension, altered mental status, severe shortness of breath, signs of shock, or new stroke symptoms like facial drooping, arm weakness, or slurred speech. These patients require immediate intervention. Here's today's clinical judgment takeaway. When you see atrial fibrillation, don't stop at recognizing the rhythm. Ask yourself, is my patient stable? How is this rhythm affecting perfusion? And what complications am I trying to prevent? Strong nurses don't just recognize arrhythmias, they anticipate what those arrhythmias can lead to. And that's clinical judgment.